Hi, my name's Phelicia Hopster, and I started kidswithbraininjury.org. It's a foundation for pediatric brain injury survivors. I actually started it because on September 24th, 2009, my son was hit by a car. It started off being like any other day. I went to work and he went to school, and then we came home and he had about 8 minutes before open house, and the little neighbor boy came over and he says, "I think your son was hit by a car." And being an x-ray tech over at Rady's Children's Hospital, I didn't think much of it. Maybe a broken arm, broken leg. Kids get hit all day long. It's actually sad to say it's pretty good job security in a sense that they are rambunctious, and we need x-rays, and it's just a fact of life. So I didn't think much of it. So I ran down to the end of the street, and he was lying there, postured and seizing. Blood was coming out of his ears, nose, and mouth, and at that time I knew that he might not survive, and if he did, he definitely would have a brain injury. They said they'd take him to Rady's, which I had just gotten off work early, so I went right back as a patient this time, though. Never been a patient. He was healthy before, a very active, rambunctious boy, so I figured we'd always have a broken arm or something, but not so severe in this sense. So at the scene, everyone was there, and I thought that this couldn't be happening to me, especially being a x-ray tech over at Children's and seeing it happen to others. You just think that maybe you're exempt from it. And anyhow, we went back to Rady's, and they said that they were going to put him on life support and that he probably might not survive. So they put him on life support, and he was on life support for a month. And when he woke up, I thought that was it, that the worst was over and we were going to go back to some kind of consistency of normal. But he didn't do anything. He just lied there forever, kicking his leg and looking at the wall, and was unresponsive to anything that you did. So I thought at this point, they asked me if I wanted to put him in a convalescent home, and I had just had a normal kid a month ago, so this was all too surreal for me. They said I could take him home like this, and so he was like a 9-year-old newborn child, and changing diapers and feeding him through a G-tube. He ended up getting a G-tube as well as a baclofen pump, which is a medical device implanted in his stomach. It gives him baclofen, which is a drug that controls spasticity and tone, and without it, he would still be wheelchair bound to this day. He actually walks now. He talks. He didn't talk for a long time. They said he probably never would talk. And then about 5 days later, he just wanted to call the dog, and the dog wouldn't come to him because he didn't talk. So he started talking the dog's name only, and which we were ecstatic. The voice box was really technical, and he didn't want to use it, but it is a great device if you had to use it. Some of our friends that we've met along the way have voice boxes still to this day, and they're still wheelchair bound. So each brain injury is different. It lasts forever. It definitely doesn't go away. Our normal will never be normal again. There is no normal in our household. We definitely don't look towards the future like we did before. Oh, going off to college, doing great things. We just now live day by day and take everything for what it is, not for granted, like walking and talking and eating. He's back in school. He's doing great, but it's different. He's a special needs child now. He's totally different. I think the biggest advice I've learned along the way from another brain injury parent is that you never get to mourn the loss of your child, because they're still here. Everyone sees that they're still here, they're still alive, but they're not. It's a totally different personality. It's totally different aspirations, goals, dreams. So it's having like two childs in the same body, two different personalities. So the old Victor used to do all kinds of different things. The new Victor's really nice and loves the flowers are always blooming. So it's totally different. I'm definitely grateful to have him and that he survived. But that's one thing I guess that other brain injury parents don't get to express, because everyone doesn't think about it unless you live it. Brain injuries happen daily, though. they happen all over, everywhere. Like I say, you can fall off the ladder, shaken baby syndrome. You're having a party at your house and we're in the pool one day and nobody was paying attention to the, toddler. It's not just because you got hit by a car or you were born like that. I always thought everybody who was severely disabled, when I seen them even come into the hospital and taking x-rays on them, that they were born like that. And I thought, oh, these parents got this because they've been doing this for a while, not knowing that they just had a normal child a week ago and they have no clue how to push this one in the wheelchair down the hallways. So it was a blessing that I had worked for Rady's, that I knew the environment and the staff. It was not good in a sense, though, that I knew too much, and I knew exactly how it could go. After he didn't wake up for a couple months, I thought about, not resuscitating him if he were not to breathe again, just in a sense that being a vegetable for the rest of his life was not the endeavor that I had looked forward to. But brain injuries, I wanted to stress that you definitely can't give up. And the brains and the neurons are connecting all the time, and the healing takes place in the first 6 months or 6 years down the line. So you definitely have to have patience with the brain injured child or adult, because if you don't, you'll lose hope and it'll get more frustrating. And don't dwell on what you had, more so be happy what you've gained and look forward to each day in a different sense. Now that he's been a special needs, I've met great parents. I've had the ability to do great things, and I hope that just getting the message out to other brain injured parents that you're not alone, that there are other parents out there, and that this happens daily, and don't feel guilty in the sense that you weren't paying attention or it's all your fault. Just kind of move on and look towards the resources that you do have. Definitely get a hold of a different special needs parent. Like, don't think just because you have a brain injury that you can't call like the Cerebral Palsy Foundation or Down syndromes and set up play dates with other special needs kids, because we're kind of all in the same boat now. That's really all the message that I'd like to preach. Definitely, if you'd like to go to the website or contact me or Moms to Madre, as they are a great website as well. Mine is kidswithbraininjury.org, and thank you.